All right, welcome everyone. It is 1 p.m. Eastern. Thanks to those of you who have been waiting around for a while. We are going to get started. Hello, welcome to the webinar on a pre-treatment guide to homeless outreach. I'm Michael Durham and I will be your moderator for the webinar, which is presented by the National Healthcare for the Homeless Council with support from the Health Resources and Services Administration. This is a 90-minute webinar with time allotted for Q&A both in the middle and at the end. Please actively use the chat box below the presentation slides to interact with our presenter. You may also raise technical issues in the same chat box or by calling the main office at 615-226-2292, extension 241, and you'll be asking for Cecilia. This webinar is being recorded and will be archived on our website, nhchc.org, the week of October 7th. So our presenter today, who is on your screen, is the inimitable Jay Levy. Jay has spent more than 30 years working with people experiencing homelessness in New York City and across Massachusetts. He is currently the PATH Regional Manager at Elliott Community Human Services, the statewide PATH program in Massachusetts, and teaches at Anna Maria College. Jay has authored several books, the most relevant of which to today's presentation is called Pre-Treatment Guide. I've got it in front of me. It's an incredible read for homeless outreach and housing first. Just one more thing to say before we pass it over to our presenter is that the Council is a technical assistance provider, a national organization supporting those who serve people experiencing homelessness, and outreach is one of the most common things that we address in our work, and particularly this tension between the necessarily slow relationship building aspect of outreach and the simultaneous drive to increase productivity. And so we hope that this webinar sort of addresses that tension and will give everyone who does this work an essential theory for how to do this work better. So with that, I'm going to mute myself and hand the mic over to my friend Jay.
Hey everybody, it's great to be here, wherever here may be. And you know, I'm really excited about this opportunity today. I must say that I've done a lot of work over the years with healthcare for the homeless, street medicine institute, and of course outreach teams locally with me in central Massachusetts, the PATH team, Western Mass, where I'm the regional manager. And it's just a privilege to do this work. It's very meaningful work. And it's interesting because, you know, I've heard people say, there's no real heroes. But when I really think of the work that people are doing out there, whether it's the nurses and the doctors, the paraprofessionals, the social workers from Healthcare for the Homeless or Street Medicine Institute or outreach workers across America, it's incredible work. It's heroic work. And we're doing it in terms of circumstances and environments that are very, very difficult. Whether it's in shelter, on the streets, in back alleys, in the woods, along the riversides, or wherever people who are homeless may gather. And it's very hard to be out there because there's a certain amount of unpredictability. We don't often know what we're stepping into and what's about to unfold with any client meeting that we have, or a prospective client for that matter. So there's a lot that we don't know walking in. And I felt over the years there was a real need for a guide that would not really take away from anyone's creativity or anyone's expertise, but to help set the table so that that can be applied in a very important way, because we want to cue into the expertise of the client, but then allow whatever we come with to flourish and kind of co-produce dialogue. That's going to be what a lot of today is about, getting to the point of open dialogue and being person-centered. So that's our quest, and I look forward to jumping into this with you. And speaking of dialogue, I think it's really important that you feel free as I'm talking to put in your questions or just your reflections on what's going on. And my hope is that we can have a bit of a conversation. There'll definitely be time in the middle and at the end. of the presentation for reflections and questions. And I hope to draw off of your expertise in terms of your thoughts of what works and what doesn't work in the field. So for today, there's 3 questions for consideration, and I hope I do a good job at answering. The first is, why is it important to understand people's stories? Or what is the advantage of thinking in terms of a person's narrative? So I think what's important to hear is us tapping into the expertise of the client, and that comes out of their story, their words, their ideas, their values, their culture. Now, if we don't tap into that, if we don't understand it, then our interventions can often fall flat. Secondly, what is pretreatment and its 5 guiding principles of care? Now, I'm going to draw off of today 5 universal principles that I think all of us are going to agree have merit, is true, are well researched, and is really the premise of what our work is based off of. So in many ways, what I'm going to talk about is things that you're already doing. But what I hope to do is to give it a little bit of a different filter, a little bit of a different look, so you can actually use pretreatment as a guide. In other words, it's going to provide you with kind of some stage theories and some ways of thinking that will help you to get where the client's at and to respond accordingly. Thirdly, what are some pretreatment strategies for promoting engagement and productive dialogue? So you're going to hear me use that term a lot today, right? Engagement, relationships is at the center of everything we do. Really, the work is built on that. It's the foundation. And productive dialogue, meaning how are we going to be able to cross the many cultural divides that we come across in the work that we do? And dialogue, our voice, the way we communicate, these are our main tools toward making this happen. And specifically, we're going to talk a lot about stages of engagement and stages of common language construction, because I really think that's going to help lead the way toward crossing those cultural divides. Now, there's a gentleman named Michael Rowe, a professor, a researcher. He's written a lot on homeless outreach, and I love that we're videotaping today because, or video streaming, I should say, because I can do a little show and tell as we go. So here's the book, Crossing the Border by Michael Rowe. I highly recommend it. And Michael Rowe says that homeless outreach takes place at a border that divides one world from another. So on one side of this border, we got the world of the prospective client, the person who's homeless. And it's very important that we're able to cue into their values, their aspirations, fears, have some knowledge that they've been through trauma, because trauma and homelessness, as we know, is connected at the hip. Their challenges, the challenges of survival, and kind of the skills that it takes to survive out there. Their process of transition and adaptation to different environments. Their culture, their needs, their wants, their goals. And along with all of that comes presentations of perhaps consisting of mental health concerns or addiction or some kind of medical issue. And all of this might be exhibited behaviorally for us to see and witness. But it's important that we learn to respond to the whole person as opposed to responding through the narrowness of kind of a diagnostic assessment or a medical model. Now that's going to come into play. I'm not discounting those kinds of assessments. They're very important in the work we do. But I'm here to talk about pretreatment, which is how we set the table for the expertise to be applied. Now we know that trauma and homelessness is linked. And the challenge to care is really about how we can go along in being interpreters and bridge builders. Like I said, our objective is to utilize dialogue and to cross cultural divides. And so on the other side of this boundary, this border, is the world of services and resources. And let's think about that for a moment. When I talk about services and resources, I like to think about the concept of houses of language. And so you might have the house of language or the culture of, say, AA as one example. And AA comes with the 12 traditions and the 12 steps and some of the sayings like a day at a time or easy does it. Or people think about higher power. Or when you're in a meeting, someone might raise their hand and say, yes, I'm an addict. That's a whole culture. That's a whole way of thinking. And when we try to make that match from the world of the client to the world of AA, the question is, how do we build that bridge? How do we make that happen? Think about for a second the challenges of connecting someone to a mental health clinic and the way that house of language is built. When you go through an intake, they're going to ask you things like, have you ever been suicidal? There's going to be questions about, of course, mental health, psychiatric history. People will be asked, have they been on medications before? And what medications have they taken? There's an office culture to showing up at a mental health clinic, being able to wait in the waiting room. There's rules around whether you show up for appointments. If you miss 3 in a row, you might be told that you can no longer attend. There's issues of eligibility in the sense of, is someone raising their hand and saying, yes, I have a problem, a mental health kind of problem that I need help with? Or is the person actually pre-contemplative about their mental health? And also the word treatment. Just think of that very word treatment and how that comes across to people that we work with in the field. Some people feel like, you're giving me the treatment. It's not a friendly word. It can be a very cold word. Some people are used to the word and they use it. Others are not comfortable with that. So connecting to common language is important, and building bridges based on common language to make the referrals we want to make is essential. The last example I'll give on houses of language, and we'll get into some specific examples as we go along. Think of the world of Social Security. Even when applying for benefits, this comes up. It's built on this notion of disability and whether you can work and not work. And then the question is, the people that we're working with, how comfortable are they with that term disability? And how do we frame things in a way where people can have a sense of dignity and apply for benefits if that's what they qualify for? Now, I've been doing this work for over 30 years. I spent a lot of time in the field in New York City, Boston, in Western Massachusetts along the woods and the riversides. And one of the great lessons I've learned is that the people that we meet are doing more than simply surviving. Now, this is important. Of course, survival is important. The way people transition and adapt is critical. And there's a bunch of skills that goes around that we want to tap into and learn about. But beyond that, I met people who really had a sense of purpose or a sense of meaning. There were some people I met that, yes, they were in despair. Maybe that meaning and purpose was there. But the vast majority of people I met had a way of thinking about their world where they felt they were in the midst of doing some pretty important things that perhaps as an outreach worker, we often miss. So my question to you and for you to think about today is, how can we tap into that meaning, that sense of purpose? I like to say it's human all too human in this, that both Dr. Keegan and Dr. Frankel will tell you that we are meaning makers. That's who we are as people, our stories and the way we think about things. The meaning that we find in the world is important. It drives us. Now, Dr. Keegan is a developmental psychologist, a researcher, a teacher. And so he thinks about the stages of development and how at each stage of development, the world materializes in a brand new way to us. So think for a moment about the world through the eyes of a child, or through the eyes of a young adult, or the eyes of an elder. and the needs, the wants, the expectations, how they're all going to be different based on that world sees and interprets. And so when we're doing the work, it's important, obviously, that we make some adjustments if we're working with an elder versus a young adult. There's different developmental challenges. And that's just one layer of the work for us to think about and the meaning that people have in the world based on their stage of development. Now, Dr. Frankl wrote this great book. It's called Man's Search for Meaning. I really recommend this very strongly if you've never read it before. He presents in it logos therapy, kind of an existential therapy for helping. And it's very much centered on purpose. And Dr. Frankl knows a thing or two about trauma because he came out of the horrors of living in a concentration camp during the Holocaust. And one can only imagine what he must have witnessed. And he's learned, and he tells us about, the importance of purpose for being able to survive and to get beyond that. He has a great quote that I love referring to. It's a quote that goes like this: "Despair is suffering without meaning." So think about it for a moment. When we're doing work, when we're doing outreach, yes, we will find some people in despair. But if the person seems pretty functional, if they've transitioned and adapted to these very harsh environments in which they're in, I'm suggesting that it's important that we think about how to tap into their meaning and how to utilize that in our work to trying to help the person to get the health care that they need. I think that's a very important consideration and often overlooked in the way we talk about homelessness and outreach. So with that in mind, let me give a case illustration. I'm going to give an example of turn back the clocks to the 1980s. Ronald Reagan was in the White House. Homelessness was on the rise. And I was a young social work grad doing homeless outreach at the Port Authority. And it was there that I met, for the first time, someone who I, to this day, consider my very first real field advisor. He called himself Old Man Ray, and he had become a fixture at the Port Authority. And I'm going to read something from the book, Pretreatment Guide for Homeless Outreach and Housing First. And it's just a revisiting of Old Man Ray's narrative, which I wrote about in the past as well. During my first days of outreach, I was immediately puzzled by the deceptively simple task of helping an elderly homeless man who lived at New York City's Port Authority. He was a short, stocky white male of 67 years with a long white beard. His mobility was somewhat hampered, but he could move slowly about by using a cane to get around to the shops throughout the building. He spent most of his time sitting on a milk crate and observing the multitudes of people making their way to work and other activities while quietly having a quick nip. You can count on him to be there on a daily basis, along with a variety of shops, newsstands, and commuters. He called himself Old Man Ray, and he had become a fixture at the Port Authority. The first time I approached Old Man Ray, he surprised me with his outward sense of satisfaction and connection to his environment. In fact, while I was still transitioning to my role as an outreach worker, Ray had long been adapted to his life at the Port Authority. During our first meeting, he said to me, "I am the night watchman." What I do then is ask. He then went on to inquire how he could be of service to me. You see, in my mind, he had immediately reversed the tables. My offer to help him did not resonate in this world, and I left our meeting feeling a little stuck, yet excited about the challenges of outreach in what appeared to be the enigmatic world of homeless individuals. I was left with an important and at times the central question of outreach. How do you help those who are clearly in need and yet communicate no need for help? So when I think about this, and believe me, when I read it, it's like yesterday. I can visualize it. I was this young guy from Columbia University. You know, I had my list of resources and referrals that I could make. And I'm thinking, I see this elderly gentleman, and surely he's in need of my help. And the two questions I think for us to ponder is, number one, what was the cultural divide between Ray and the worker, or Ray and myself? Now, that's an important question. We should be asking ourselves that question as we do outreach in the field. Secondly, how did Ray deal with his trauma of living in such a harsh environment? How is it that he transitioned and adapted so well? So in terms of the first question, as I said, I was this young guy just out of college. And if you look at things developmentally, in terms of the meaning I had in the world, I thought surely I could come in there and be an expert and be of help, with my degree and my resources, and certainly an elder gentleman who was not very mobile, who was sitting on a milk crate, who had a cane, would be receptive to my services. But what did Ray do? He reversed the tables. And I think part of this definitely connects to the idea of us being at different places developmentally and in the world. This was his world that I was entering into. And what I was not respecting is that Ray is an expert on his own world. Now that's a very important notion from narrative circles. They talk about that. And you're going to hear of a lot of narrative psychology reflected in my words and ideas as we go along today. So I needed to respect, first of all, that Ray was an elder. So, they say respect your elders, right? I also needed to respect and understand that as an elder, Ray may have a role to play in this circumstance. He's the one that could be telling me stories, who could be schooling me because I'm the young guy. In fact, if anything, that makes a lot of sense. If you think about a young guy, perhaps he saw me, and we always ask, how does the person experience our interventions? He saw me as a young guy who was wet behind the ears, who needed schooling. And how did he deal with the harsh environment of being at the Port Authority? He did something that seems rather miraculous. He somehow went from being what we would consider to be a victim, an elder, homeless in a bus station, to actually being in charge of the Port Authority. He was the night watchman. And it doesn't matter whether that's literal, metaphorical, whether he's delusional, or whether it's something he means just in the sense of that he knows a lot of what goes on around the place. What matters is this is how he was coping. And what I'm kind of saying, I think, quite strongly at this point, is we need to work with that. We need to connect into people's worlds and kind of use that rather than discount it and try to be the expert. When we try to do that, that's when we lose a lot of people, because it starts to challenge their own sense of meaning as well as their sense of autonomy. And that's a very important concept, people's sense of freedom and autonomy and how we respect that. So in terms of the central question, how do you help those who are clearly in need, yet communicate no need for help? My thinking, and this is really where pretreatment came out of, is to think in terms of a pre-treatment approach. So everything begins with the relationship. We all know that. That's the foundation of our work. So if you can visualize for a moment the stages of engagement, and you're going to hear me talk now as we get into pre-treatment principles, a lot about stage theory. And stage theory is very important because what it does is it helps us to get where the client is at. That's the cardinal rule of all this work. What tends to happen is we often lose track of where the client's at. But a stage theory will help us to stay in line with where people are at. And understand when we go through stages, they're not necessarily linear. They're linear in the sense that one stage comes after another. But at any point, the client dictates what stage they may decide to go back to. And then it's up to us as the worker, as the counselor, to make the adjustment and do the proper intervention. So stages of engagement begins with pre-engagement. And when you first try to meet with someone, if you can visualize that process, I know you've all been through it, we're really looking for an initial welcomed communication. And we're dealing with issues of trust and safety. I like to think of it as trust versus mistrust. And we're hoping to show that we're somehow trustworthy. So how do we do that? In some ways, it's announcing that we're there. In other words, we're not approaching people from behind. We're not surprising people. They can see that we're coming closer to them. We're respecting things like personal space. We're observing as we're approaching to see if this is kind of safe for us. Because another thing about this is you're going to notice that there's a reciprocal process going on of observation. We may be observing the client and saying they have issues of trust and safety. Or we have issues of trust and safety. It's being mirrored on both levels as we go through this process. So as we approach someone, what I like to do, since in a sense we're entering their space, their home, is to come with a need item, something that perhaps they can use. Often it's something like a pair of socks. And I'm fond of saying, if you want to get to someone's head, begin with their feet. That's kind of an anonymous piece of wisdom from Homeless Outreach. I don't know who said that originally, but I think it's a great one. And so offering socks, or as nurses may know who's worked alongside, in healthcare for the homeless type settings, give someone a foot soak, and boy, they'll start, talking. It's a real chance for a conversation. People feel taken care of. Well, if you want to ask an initial question of how someone's doing, one of the questions you can ask is, how is your feet? Most people will understand that question because they know they value the importance of the health of their feet. When we get to engagement, you're going from trust and safety to this idea of trust and safety again, but also autonomy. So it's important that when you're engaging with someone, that what we're trying to do is to get where they're at and not tell them what to do or how to live, but to cue into their words, their ideas, and their values. And what we're doing is establishing roles. So we're really going through not only listening to the wants and needs of the client, but also we're mentioning the type of services we can now offer. In a sense, this is our chance to begin to set some boundaries, to define some roles on what the work can be and what the work can't be, while really cueing in to the client's needs, wants, language, and reflecting that back so that they feel heard. And finally, where this is all going in terms of engagement is to contracting. We're trying to get to the point of setting up mutual goals. And it needs to be a goal that the client can have ownership over, because we want to build a sense of initiative in working towards things. And for that goal, for the client to have ownership over, it's very important that the goal is in the words of the client, that it reflects the ideas and the wants of the client. It should not be in our clinical language. It should not be based on our service plans and need areas and the way we document. When you document, you're going to do that with a different set of language. But in working with the client, you're going to use the language that the client connects to, that reflects the particular goal that you're working on. That's very important. So what we're going over really so far is the first principle of pretreatment, which is relationship formation. The second principle is common language construction. And as I said, it's so important that the goals reflect the words, the ideas, the values of the client. And that's the key to working on a common language with someone. So the idea is that over time, we set up a playground of language. And the playground of language is the words and the ideas that are welcomed on that playground by the client. The client rules the playground. We can make suggestions. We can throw out some words, see if it triggers the client or not, see if they connect to what we're talking about. But ultimately, the client can say, I don't like that notion, that word, that goal. And if that's off the playground, then it's off the playground until we find a way to reframe it in a way that resonates with the client, where they're accepting of it. When I talk about common language, I also think in terms of stages of common language construction. So the first stage is understanding the words and the ideas and the values that are being spoken about. The second stage is utilizing those words in the offerings that we make and building our playground of language with those words and ideas. The third is bridging language. How we, when we make an offer of a service, can bridge the language from, remember that house of language of the service, how that can connect with the house of language of the client. So a quick example, I was working with an elder, a guy who was in his 60s, a Latino gentleman. I met him out in Boston, and he's from Puerto Rico and very proud that he was out on the common and barefoot and telling me about the rocks and sands of Puerto Rico and how that was fine. I was offering him as a need item some socks and shoes, and he was, in response, trying to tell me about his culture, and I needed to listen to that. So in the end, we kind of negotiated, and I ended up offering him some sandals, which he was willing to accept and very grateful to get. But from there, we were talking about his housing situation. And the offering was made to try to get him housed. He wanted to get housed. And so we were looking at getting housed with a priority as an elder through the housing authority. But the problem was, when I used the word elder, he turned off. He did not like that term. He did not consider himself to be an elder. Now, he knew he was 60 years and over. He knew that much. And he saw himself maybe a little bit more at ease with the term senior, as we reframed and talked about senior as in seniority, as in having wisdom, as in being someone who's been through a lot, and being deserving of housing and a better way to live because he's been through so much. And then he was more accepting of the idea, but he threw the term elder off the playground language. So I just wanted to give that quick example so you understand what I'm talking about. When we get to some case illustrations later on, we're going to talk about different levels of this using words and ideas and values of the client and the work that we do and working with their meaning. This is just a simple example so you can understand a little bit about common language construction as we go. Cultural and ecological considerations, the third principle, that's a rather large area. For this presentation today, let's just talk about the idea of person and environment and the process of transition and adaptation to harsh environments, and the idea that transitions are going on all around us. And it's very important for us to be able to cue into these transitions. So whether it's transitions to relationships, to ideas, to services, to resources, the treatment, the housing, it could be transitions around the weather. It could be transition because you're working with a client who just got kicked out of the library and now they can't go back there. Maybe there's a bar and they have to deal with, now what am I going to do in the daytime? The more that we're in line with understanding what transition is going on and we offer help with that, the more likely there'll be some acceptance of that assistance. So I talk to my staff a lot about this idea of catching the transition bus. And some ways and some basic tools of supporting transition can be on the level of role play. If someone is, let's say, preparing for an interview, whether it's for housing or for a job or whatever it is, or you could do some things around desensitization, which is kind of approximations to an environment that the person may find at first a little bit threatening or unprepared for, but over time can get used to, such as housing. Have any of you ever worked with someone who's been homeless 15 years or long-term homeless, and you try to place them in housing, and they have some issues with staying in the room, they have some issues with feeling like that room is safe, that they can be comfortable there. So how do we help to desensitize them to that environment over time? We have a couple people now that we're working with where we're in the midst of that process. The fourth principle to consider is to facilitate and support change. Now, of course, this could be a whole presentation onto its own. I draw off of the change model and motivational interviewing, of course. And I think what's helpful is to think about the stages of change and to think about it along a number of domains. So the domains that I like to look at, and you can add or subtract, but this is how I kind of frame it out with my staff, and my staff have kind of framed this out with me in kind of open dialogue in terms of what makes sense. is we look at one, how will the person be able to get an income? So that's one issue. In other words, is that something they're thinking about? Are they pre-contemplative of generating an income? Is that something maybe they're already doing? Perhaps they're on the corner asking for money, so on some level they're already thinking about income, but that seems to be important to them. Two, the second domain is housing. Where are they in terms of their interest in housing? Are they pre-contemplative? Have they given up? Is there a sense of maybe learned helplessness or such a meaning and belongingness to the homelessness environment that they're not even really thinking about being housed? Or is that the first thing they're asking? Like, I want to get housed. I want off the streets. And maybe they're already doing some things. That maybe they're in an action phase, in other words, of actually searching for a place to live. And how can we support that process? Thirdly, we think about really like trimorbidity. In other words, this comes out of addiction, a lot of this. So certainly one of the things we look at is addiction. And if the person has an addiction, where are they at in terms of the stages? And they could have more than one addiction, right? So it's possible that when it comes to, let's say, alcoholism, they're pre-contemplative, yet in regards to their opioid use, they may be very aware that that's a problem that's challenging their health and that they may die if they continue to do that. So they could be at different stages depending on the addiction. The same thing with mental health. When we look at mental health, someone in terms of their anxiety or depression, they might be willing to talk about that. But if they have something else going on, like some paranoid thinking, they may be pre-contemplative about that. No sense that there's any kind of paranoid thinking going on. And so we're going to respect that, where people are at, and based on stage, we're going to think about the type of interventions we do. And then the same is true for medical issues. And if you think about desensitization, often a lot of the work that we do might begin more on the medical end, how someone's doing, and then slowly get to these other issues of addiction, mental health, and so forth. So there's a lot more I can say on change model, as you can imagine. Maybe it'll come up in discussion. But the last principle I want to talk about is promoting safety. And this is a big one. It's right out front. And one of the things to think about is we do a lot of harm reduction work. And harm reduction can be a lot of things, whether it's a needle exchange program, a methadone clinic, Suboxone groups. It could be on the level of a housing first program, right? Housing first can be thought of as harm reduction. And when we do outreach, it could be that someone's cold and staying outside and won't go to shelter. And we're providing them with a sleeping bag, or we're providing them with a blanket to stay warm. That can be harm reduction too. But the key with harm reduction is we're going along with where people are at. We're meeting them there, and we're offering something they need that also promotes their safety. And then we're using that, we're pivoting off of that, because that's also an engagement tool. And we're getting to know the person. And you can think about all the other things I said about pretreatment. We can get into that kind of work. So harm reduction is often involved in the sense that we're trying to melt the pre-contemplative iceberg by doing a little bit of, here's a need item, it'll help you to be safer today, but through the work that we do, particularly our relationship building, developing the trust, and beginning through change model to point out some of the discrepancies in the person's world by continuing to live in the way that they're making these choices to live, that it may put them in harm's way, and there might be some other ways to consider. The other way that we work with promoting safety is crisis intervention. So sometimes we need people, like I said, who are in real despair or who are very angry, who may be a threat to others, or maybe in crisis medical, because I know there's a lot of healthcare for homeless folks coming out there and meeting up with people. But the point is that we need to understand when someone has an immediate need or their safety is at immediate risk, and to be looking at it as crisis or emergency type work and having those kinds of responses. What I say to my team all the time is we must embrace the crisis, because the crisis is a real opportunity to connect people to the treatment that they need. It's a way of really, if you think about harm reduction, we're going a little more slowly. We're working on melting the pre-contemplative iceberg. But when a crisis occurs, we can be more directed. So it's a more directive stance, and there's more of a concern there because someone might actually get hurt, and they're in this disequilibrium. If there's a mental health issue, their ways of coping is hitting a wall, and they might be open to a little more direction, or we may even have to consider, unfortunately, some involuntary options if we really think their health and well-being is at risk. So that's the 5 principles of pretreatment in a nutshell. What I'm suggesting to you is that all of these principles are simultaneous, and it's something that we need to be thinking about, and not just working on one but not the other 4. And that you can see most of them are based on process and stage theory, and it really helps us to think about where we are in the work that we do to help guide us. So I look forward to the second half where we'll actually get into a number of case illustrations. But I'd really love to hear from you what you think about this, whether this makes sense or not. I hope I didn't talk too long in the beginning, but I really want to open things up and just hear what you're thinking.
Yeah, thank you, Jay. I encourage everybody to use the chat box actively now. We're going to just take a break here in the middle to check in and see how this is resonating. You can type maybe an anecdote about how these kinds of ideas are real in your life and your work, or submit any questions. Jay, we've gotten one question so far that kind of gets at something that you hinted at, and just when you were talking about the outreach worker providers' questions that they are using based on some sort of whatever assessment tool that is prescribed for them. Like, so maybe it's whatever intake form that the outreach worker is required to use. How do you translate that language into the language that is useful on the client's playground? So the question here is about like a social determinants of health, SDOH screening tool. Can you talk about maybe how do you use something like that effectively, but without making the client feel like I'm just answering a questionnaire, whatever?
Right. So, I mean, I don't know that particular assessment tool, but where we're starting again is with engagement, and it takes a certain amount of time to get to the point to know the language of the client, and we really want to think about at what point do we start to ask these intake questions. So obviously, to some degree, by the time we're asking these kinds of intake questions, like for instance, our roles are defined. They understand kind of where we're coming from and the types of questions we might ask in terms of our field of expertise. That being said, I think we are translators. So we are thinking about when we have a question, we know the type of information we need. The question is, you have to be pretty nimble to think about and individualize that question to the client, to reframe it and say it in a way that might resonate in their world. Because if by asking these questions, the person turns off to the offerings we want to make, then that's not very useful. So we really want to think about a little bit about the timing of when we begin asking these questions, when we begin writing things down and doing intakes, and who can tolerate what. And are we more in pre-engagement where really we shouldn't even be doing that yet? Or are we at a point where the person now is at a point of contracting and they're actually more of like officially on our radar as a client? And at that point, we might be able to sit down and do some of the specific intakes, but it's really based on the knowledge that we've garnered through the engagement phase.
Perfect. So this question this next question resonates with a lot of what's happening in the current administration and the way that homelessness, and particularly unsheltered homelessness, and again specifically in California these days, has become such a politically charged issue. And so it's like, I feel like for us, we are excited that homelessness is in the political conversation, but it's taking place in a very harmful and
stigmatized,
destructive way. And so what advice do you give to like homeless outreach teams who are, in the midst of such politically charged environments, just based on what you were saying before?
Well, there's a lot of expertise out there right now. So, I mean, I could tell you some of my personal opinions on that. It's not an area where I'm certainly an expert or anything. I mean, I think, first of all, I invite other people to type in some thoughts to that very important question, because I think that's what's great about open dialogue is we can kind of learn from each other in the different circumstances we're in. What I will say, though, is that a lot of the work we do that I talked about, that we try to do with the clients that we're serving, in a sense, we also have to do that with the different systems of care. That's another cultural divide that needs to be crossed, and with the politics of care. In other words, we have to find the words and the ideas and the framing and understand what resonates and get an idea of who our audience is, who we're talking to, and what's important to them and what they value, and then how we can reframe things in a way where it gets across the needs of our outreach service, the needs of the people that are homeless, and what works. And so I think a lot of the trend toward more and more data, in some ways I can see why that's happened more and more, even though I think at times it's difficult to meet those demands. Because the more data we have, the clearer we can make the case to people. And so I think it's sort of a mix of data that kind of support the work we're doing and in the way that we're doing the work and why that's important. And then it's also being able to tell some of the stories, but telling the stories in a way that really brings out the fact that this is a human, all too human kind of situation. That homelessness is really kind of a microcosm of the human condition. And I think the more we can tap into that and then talk about some of the effective practices like housing first and how that's really in everyone's interest. And I'm going to get to that perhaps a little bit more to the political end of it in the next slide or two, because we'll talk a little bit about the costs of homelessness. And I think we need to have those numbers and understand what that's about and how, not only how it impacts things financially or in terms of mortality rates, but also in regard to people's quality of life. And there's a way to talk about this where we're also concerned for the businesses in our communities and the parks in our communities. But we're also interested in the quality of life of the person who's homeless, first and foremost. So the quality of life question impacts all of us. Homelessness impacts all of us. And the question is, what can we do about it and what really works? And I think we have to do our best to present what we know from the work that we're doing, as experts in the field. But do it in a language that has a better chance of resonating. So really, it's thinking about who your audience is when you do that.
Right. And I think you've touched on some of these themes already, but let's just confront the term service resistant and how when you hear folks, I don't know who they may be, funders, or maybe they're outreach workers or their clients, and we hear this term a lot in the field. How do you confront that idea? How do you help folks understand this concept of being service resistant in a different way?
Yeah. Well, I think, what pretreatment is all about is how we get person-centered. And what we see is that when we're not good at getting person-centered, then this idea of service resistance comes up. So it's really more about us as a service and the type of offerings we make than about the client themselves. People are not resistant. People are ready to do whatever they're ready to do. The issue is, are we getting where the person's at and making an offer in a way that it can resonate? Now, you could have two people make the same offer. One's an authority, and one has gotten to know the client and has developed that kind of trust. The client sees that their autonomy is being respected, and they'll be more keen on the offer from that person than the person who's an authority making the same exact offer. And then some of it comes down to language base and using the right words and working with the playground of language as well. So do we reframe the offers in ways that it can resonate with the client, or do we just go with our standard, and this is very important, we often go with our standard clinical language, or the person you're working with is thinking, man, I've heard this 1,000 times, it just doesn't work for me, like here's another person reading the same script, and they're turned off to that. It's about getting where they're at and making offers that can resonate. And when you think in terms of stage theory, that helps you to get there. And I think it helps us to really get rid of the term resistance. It's the notion that the client is always ready, but are we ready?
Thank you. There aren't any more questions that I can see in the box, so if you want to kind of pivot to the second half, Jay, I think we're ready.
Okay, great. So there's 4 keys to pretreatment that I want to talk about real quickly. First is that we're very optimistic. You know, instilling hope is very, very important in the work that we do. And there's a number of studies now that shows the importance of hope in the work that we do. So we really have to believe that what we're doing can be effective, can work, and we have to believe in the person that we're working with, and that there's a lot there to draw off of, and that we're going to be able together to co-produce some sort of pathway that's going to help the person to move forward in their life if we meet them where they're at. So instilling hope is critical. Getting where the client is at, of course, I've talked a lot about that, both figuratively and literally. That's the second key. The third key is to always ask ourselves, how do our words and actions resonate in the client's world? If we're running into what someone might classify as resistance, we need to be thinking, what kind of offers are we making? And how is that resonating? And why is it resonating? And then to relook at how to go back. And where are we? What stage of engagement are we in? Are we aligned with the client in the right stage when we make these kind of offerings? And then fourthly, understand that engagement is the foundation of a pretreatment approach, while the skills and interventions required for common language development are the main tools. And for you lovers of definitions, you know, pretreatment is an approach that enhances safety while promoting transition to housing, could be housing first, and or treatment alternatives through client-centered, supportive interventions that develop goals and motivation to create positive change. And when I mention housing first, it also makes me think about that if we're very quickly housing people, then a lot of this pretreatment work needs to take place in the housing. In other words, it's not just outreach, that it would be in-reach, connecting with people, and really doing the work to help develop that pathway then to potential recovery type services and better health, which of course is very important. So let's think about a moment, you know, one of the questions brought this up, the costs of homelessness. One is, of course, the risk of death. You know, you're out there, there's been some studies, the vulnerability index, I think of, by Dr. James O'Connell, Dr. Wang, they've done some studies on mortality. And it shows that, you know, clients that fall into certain categories, if they're unsheltered, sleeping rough, been outside 6 months or more, this was a study in Boston, that in these certain categories, they were at significant risk of death. Within 5 years, 40% of the people died. Some of the categories is being over 60 years old, or being trimorbid, in other words, having mental health, medical, and addiction concerns at the same time, or their usage of emergency rooms, more than 3 visits over the past year, or hospitalizations would put someone in that high-risk category. Or having a history of frostbite, or hypothermia, or trench foot. Isn't that amazing? Just a history of that puts someone in that high-risk category. Anyways, there's more categories which also include very severe illnesses like kidney disease, liver disease, and so on, HIV positive also. So I think what we have to be thinking about is if we don't do nothing, you know, people remain out there, that risk of death is high, and the average age of death of the 40% that died was 47 years old, so it's very young. Then there's the financial burden. Think of the financial burden of homelessness, just the costs for shelters and the staffing and the beds and all of that. But think of the emergency service usage, people in emergency rooms, people getting hospitalized regularly, police responding, people in our jails, you know, the criminalization of homelessness that's occurred, unfortunately. The response of EMS and ambulances and all of that. it's just a very, very high cost. It's a big financial burden on the healthcare system. And, there's a lot of studies. Sam Semberis, who's the father of the Housing First movement, James O'Connell and others, have done a bunch of studies to show, I think, pretty convincingly that we can bring down those costs through Housing First type programming, getting people in. But the key here is the staffing of those programs and how responsive the staff can be to crises and how well they know the clients and the work that they do. An understaffed Housing First program may not be as effective, especially when you get to the folks who have really been outside for long-term periods of time. Quality of life issues, I think we already covered that, so I won't go into it again, but just basically we have to think about the quality of life of the community, but also the person that's homeless. So I'm suggesting to you that this is really the challenge. It's a calling that we need to get out there and meet people and get them in because the costs are just too high. And this is why I really look up to the people that continue to do this work on a day-to-day basis. It's really hard work, but I also know that it's meaningful work. And the stories and the people we meet is just incredible. So with that, let me go into some examples of some of the work that's done. And in particular, I'm going to focus on this idea of common language construction. But we're going to talk about it on some different levels because it's not just about specific words. Sometimes it's about connecting to meaning or other things. So the first example is Lacey. I met her out in the Westfield area. She was in a park feeding the birds when I first met her. And as an outreach worker, what we try to do is to talk about the things that are very public. We're not trying to get inside people's heads. We're beginning by just commenting on an activity or something that we might be watching or observing together. So of course, I talked to her about the birds. I said, oh, that's interesting. What type of birds do you see here? Is this something you really like to do? And she was very positive. She was really interacting with me. I mean, later I turned out, as I learned about Lacey, I realized she had a very long history of trauma and layered trauma, compounded trauma. But talking about the birds, that was a safe area. That was a safe area to go. And often we find people who are trauma survivors, this is not unusual, might sometimes feel more comfortable with animals than with people. And in this case, I think she saw the birds as a very kind of safe thing and peaceful thing to be doing. And the quote that I have there, I think, says it all. It's just a wonderful, poetic quote that came out of Lacey while we were talking, just at the very beginnings of our work. She said, the birds are innocent and peaceful creatures that can rise above the mischief. And so in this case, that particular quote, I felt told me a lot about Lacey, about the idea of mischief in the world and the day-to-day challenges she experiences with people. And a lot of this is tuning into the unsaid, right? She's not saying all of that in the quote. There's always the said that someone says, and then the unsaid. This is a Heideggerian notion. But as you learn a person's world and their values and where they're coming from, you start to get a really good ear for the unsaid, and then you can respond accordingly. And that's really getting what I call like a being here connection with that person. So in knowing what that quote meant, the said and the unsaid, I was able to talk to Lacey about maybe together we can do some work on getting through the mischief or rising above the mischief. And that became kind of the premise of our conversations going forward, and that led to some good things. Now to go a little deeper on this idea of common language construction, let me introduce you to Butch, a white male in his 50s. This guy was living out in the woods by the Westfield River. I met him originally at a meal program, and he walked in and he smelled like a fire. And also there was the stale stench of alcohol on his breath. And he would sit down and people like around the table would move away from him due to kind of the mixture of all these smells. So I sat next to him, broke bread with him, and began talking. And as I got to know Butch, he was an interesting guy. You know, he had developed a tool for canning, and he said canning was his way of staying very autonomous, that he could do things his way because he had some income coming in through canning. And he had developed, he had like a fishing pole with a hook at the end, and he could use it to rummage through the baskets, the garbage cans, and find the cans, and kind of do his work. And he would ride around on a bicycle with a couple of baskets and fill it up with cans. And I tried over time to ask Butch more and inquire. It's kind of an appreciative inquiry. What's it like out there? How are you getting by in the woods? How are you feeling? And he would tell me, well, my back is kind of stiff and it's kind of tough. But at the same time, he would say that he's been out last winter and is going to be out again this winter. And anything I would offer, he would refuse outside of our conversation, of course. Well, one day, Butch offered me to come down to see his site in the woods, and I acquiesced. I went with him. And upon entering his site, my whole notion of Butch completely changed. I suddenly realized why all of my offers were falling on deaf ears. And what I saw when I entered that site, the very first thing, was I saw a memorial that he had built out of stones that he had carved into a tree to his friend. And I was awestruck by that memorial. And then Butch pointed toward the river, which was nearby. And he said, a buddy of mine drowned in these waters, and this is his resting place. This is sacred ground. And I'm a guardian of this sacred ground. And that's when Butch's meaning came into view. And I understood that when I made offers of like a place that you can go to lay your head to get inside, you know, an SRO, a single room somewhere, that paled in comparison to the meaning that he found in the woods. So the question is, so what do you do then? And what we did, I think, was quite sort of natural and organic to our work, and that is we began talking about his friends. And he started telling me the stories, good and bad, the good times, the bad times, the difficult times, the struggles, the brothers in arms. He cried, he laughed, and he got it out. He had someone who was willing to listen to him. And this was part of the grieving process, helping Butch to talk about the value of this friendship and what this loss meant to him and what it meant to be the guardian of sacred ground. And through that process, it occurred to me that there was an opportunity to use his friend's voice, his friend's spirit, to ask the question of what does he want to do now? So in other words, instead of me saying you should be housed or you should get help for this or that issue, I tapped into his friend's voice, their camaraderie, and I said, well, what would your friend want for you? I mean, winter is coming. It's going to be cold again. You're getting older. You're telling me about the difficulties with your back and with your shoulder. Would your friend want you to get inside? Is there a way to get inside and still pay homage to your friend? And can we maybe do that together? And that really opened things up. And over time, with some crises along the way, we were able to make progress and get Butch housed. The last example I want to give is about Andrew. Andrew's a black male in his 40s, and he was homeless for over 18 years. I mean, can you imagine that, being outside for 18 years? When I first met him, it was at an overflow shelter out in Dorchester. We had real limited engagement. I mean, he did not want to talk to me. And there was a cultural divide there between me being a white male social worker and him being a black male person who was experiencing homelessness. He would sometimes talk to himself. He was isolated from others. He had a cornered bed where he appeared to be observing everybody very closely. And I was curious if there might be, some paranoid ideation in some ways to contend with. Now, when someone's paranoid or someone's been through a lot of trauma, we know we can use the term safety, and that's something that'll probably resonate in their world. So that becomes one of those words that we can very quickly get on the playground of language and explore in our work. But with all that said, I want to read to you very quickly an excerpt from the book, Homeless Narratives and Pretreatment Pathways. And it's what happened after several months of seeing Andrew and him refusing conversation with me. And then suddenly one day, he opened up, sort of, a bit angry, but he did have a lot to say. The outreach clinician approached Andrew and gave a friendly greeting. Andrew responded with angry affect and said, "Don't you understand? I'm no longer playing the game." The social worker replied, "I respect that you want or need some space. I didn't get what you meant by games." Andrew in turn stated, "Look, I've been toyed with before, and it's not right. I want you to know, I want everyone to know that I'm not playing anymore. Listen, yesterday I saw $1 on the street. Do you think I picked it up? That's what they want me to do. But I'm no sucker. I'm sitting it out and just watching while others make fools of themselves." The social worker calmly responded, "I think I have a sense of what you're saying. You don't want others to take advantage of you. I mean, who could blame you for that?" Andrew, now more animated, quickly answered, "How could you possibly understand? I had a whole career taken from me. I've been mentally murdered." Andrew paused and then with some discernible laughter stated, "Do you know what it's like to be mentally murdered?" The social worker replied, "You're right. No one could fully understand that unless they go through it themselves." "I don't know what it means to be mentally murdered. Could you tell me?" Andrew calmly responded while walking away, "I said enough for now. Besides, I'm in the midst of my own research." So again, when I read that, it brings me back to those days, connecting with Andrew. And what's important is to pick up on some of the themes and some of the ideas and some of the words that he's saying, and to find a way to explore what they might mean. So one concept was mental murder. And I think already from that kind of interaction, we have a little bit of a sense that mental murder connects to great loss, to things being taken away from him. He already basically said that. But there may be more to that concept. He also says he's not playing the game. Well, what does that mean? Does that mean, in other words, I'm playing the game by making an offer to him to talk, and that he's above that? Is that his way of sort of dealing with 18 years of homelessness and the offers that have come his way that he felt have not been good? Or does he see things in some sort of way that like maybe that game is rigged, which is what I found out later is what he meant. That the game is rigged, so why would he play? Instead, he's up here watching the people down there make fools of himself. And then lastly, he talked about his research, which is sort of interesting. That's very different from the other kinds of things he brought up. And then through it all, you can hear the anger. And you can hear that maybe as an outreach worker, it would be uncomfortable to listen to that anger, but the importance of trying to hang in there and to still have the conversation. Because before this conversation, I had nothing. Now, there was a whole bunch of terms, a whole bunch of ideas that I could think about. And the question is, and the question I want to ask the group here, is what would you do next? If you were there a week later and you were to engage more with Andrew, where would you start? We're trying to go from kind of pre-engagement, to get that initial welcome communication, to eventually the contracting, where we can actually work on some goals together. So what would be your next move in terms of strategy as an outreach worker? Just give a moment for you to think about that, and then I'll let you know what I tried. So for me, the important thing to start, where to start next, was with the research. Because this was the thing that Andrew appeared to be proud of, and he seemed to be an expert on. In other words, while the stuff I might bring up could come across as condescending to him, or a white male trying to tell him what to do, or what have you, the place where I could go with this, I think that made a lot of sense, was to allow his expertise to shine and to ask about his research. And that's where we started to get into some really interesting conversations as he opened up about time travel, that being the area of his expertise. And he would say, you know, Jay, Einstein got it wrong. Our thoughts can travel through time. Our cultures can travel through time. Our ideas can travel through time. And there's a lot more to this research, but I'm not going to let you know about it because it's mine, and I want you to respect that. And what happened from that is him telling me about his research set up the option of me being able to make an offering back to him to say, look, I respect your research. That seems like it's very important to you. See, that was his meaning. That was the sense of meaning we're tapping into. And so I made an offer, again, using his term, research, to consider whether he'd like to get an office or some place maybe where he could stay. He could also sleep, but set up an office for his research to continue. And is that something maybe he'd like to work with me on? So that was the offering. Of course, he didn't immediately accept that offer, but it made him contemplate it. He started thinking about it, and we started engaging more. And one day we had our moment where he really shared his story of mental murder, his story of feeling oppressed by white society, his story of being mistreated at shelters, his story of there being a fire and through no fault of his own, him losing his housing and then going to the Y and them limiting his stay to 2 weeks because that's what they did back then. If you weren't a veteran, you could only stay up to 2 weeks at a Y. And then a story of entering shelter while he had a job working at the transit authority, giving out tokens. He was in like one of those booths. He had the whole outfit and everything. And the shelter, in his words, the way he experienced it, was not flexible enough to allow him to work his later shifts. Now, who knows how he asked? Who knows the exact interactions and the way they went on? But his experience was he was shut down from work by the shelter, so he had to leave it. And then he started staying in movie houses, all-night movie houses that were showing dirty movies just to get some sleep there in his T uniform so he could have a place after work to go. And then he felt that he lost his job because people saw him in these theaters in his uniform, and they didn't like that, and he must have reported him. So that was a whole history that to me sounded like a great deal of loss and trauma. And even though he said a number of other things, and I could see symptoms of him talking to himself, I sensed some paranoid ideation. He talked about going on job interviews where people would point the pen toward him, and he felt threatened that he was going to be attacked by whoever the interviewer was with the tip of that pen. But what I learned was I could make a connection between mental murder and trauma. And from there, we can make a connection between trauma and being homeless for over 18 years to the idea of disability, that he could qualify for benefits. And with that, we could find an income so that he can do his research in a place to live. So that was the work that needed to be done, and that's what we did. It took 9 months, but we finally got there. We got him housed. Of course, it was before housing first, so in certain situations, we can do these kinds of things much more quickly. So with that story, what I'd like to do is to open it up again to some questions, because I hope through that story you get the sense of the stages of common language development, how I listened to what he said about mental murder, how you could utilize that term and explore it more, and how we could bridge the language of mental murder to trauma, and from trauma to disability, to work with the houses of language of, in this case, it was Social Security. And also working off of this meaning and the research. So are there other questions people would like to ask? Or just reflections or thoughts people want to share?
So there was one that came in that asks about the role of like peer-to-peer outreach, and
Oh, good.
that made me think about, when you were speaking earlier about how you were, a young white guy with an MSW from Columbia, and is that, so, that informs sort of the necessity of learning how to cross the cultural bridges.
Correct.
Does this also necessarily apply to outreach workers who have the lived experience, who, lived on the street for 5 years? Can you talk about maybe the differences or similarities there?
Yeah. No, it's a great question. Peer work is very, very important. We do it in the place where I'm employed. We have peers on our staff, and they do great work. And I think even though through pretreatment, what I'm doing is I'm giving a guide to how to cross these cultural divides. Certainly there's some better ways or quicker ways sometimes to do that, because the less cultural divides you have, the easier it is to get that initial dialogue going. So that's really important. So peers really can be used, I think, in a way to open up the dialogue, get the engagement going, and hopefully transition some of that over to the rest of the team as we all work together with our assorted expertise. Being a peer is one kind of, it is an expert from experience, as you said, and that should be very, very highly valued. Also, having a team, of course, that's diverse is important. Like in this case with Andrew or with Lacey, while I gave examples of how to cross the cultural divide, and I had to be willing, in Andrew's case, to hear about white oppression and respond in a very compassionate and understanding way. And it probably took a long time for us to even get that initial pre-engagement piece going because I was a white male. Or just being a male could be a cultural divide, and reaching out to Lacey, who was female, especially with a lot of trauma, and a lot of the trauma has been with men. So having men and women on the team, having people who are LGBTQ, having diverse race, is very important. But common language construction is a very individualized approach, as you've heard, and that's really very, very effective in trying to get on the same page with people and to get away from these differences and toward really, how can I help? And saying that I'm hearing you and I'm with you and I'm joined with you. And those are the kind of conversations, the dialogue, the open kind of dialogue we want to get to. And then that opens up creativeness, because it's not a matter of our prepackaged interventions or the things that we think will work. It's more of a co-production of what kind of pathways will come up that'll help the client to move their life forward. So the use of peers is very important. And I think for peers to be, as part of their training, to think in terms of pretreatment is very important, because there's more than one road to recovery, and there's more than one or two or three cultural divides. It's really all over the place. So no matter who your peer is, there's always going to be people they meet that are not in line with their experience. And even the people that are in line with their experience might have to go down a different road of recovery. So I think pretreatment would be very, very helpful for the peer network to consider utilizing in their work. But peer work is very important. And, one of the areas I've been doing a lot of work with, and this is crossing a cultural divide in terms of countries, is with the UK. And we've been doing work in England, and they're very big also on experts from experience. I have a book that came out where a chapter was written by someone who's a big part of the peer movement in the UK named Ray Middleton, and he really shares his work and experience and how using open dialogue was key to helping.
Okay. A couple more comments in the chat box here. One is just a story. Somebody said, I had a client who did not want housing but was really tired of his belongings getting stolen all of the time. We eventually explained that he could just use his apartment as a place to store his stuff.
I love it.
Continue to sleep and hang out wherever he wanted. He thought that would be okay, and has now been housed for 3 years.
That's fantastic. Yeah, that's how it starts. It's getting where people are at. And, we just had a meeting with the mayor of Northampton. We had 5 people in the room who were homeless, currently on the streets. And the first thing they brought up as a need was storage. They're just tired of just having to carry all their stuff. everywhere they go, and they had the injuries to show it as to their bodies and as well as to their bags with tears and rips. They were overloaded. It really spoke to us saying, wow, we got to find a way to help with this storage issue. And I'm glad you were able to connect that to housing. That's the way to go.
I'm just going to read this one verbatim. It says, thanks for the beautiful illustrations of good outreach success stories. What is your experience on engagement tools? In San Francisco, we have challenges with street hoarding of belongings. How do you bring this up for clients without damaging the relationship building?
Oh, in terms of hoarding issues, well, I mean, that's a big one. And I think, first of all, we have to understand where people who are hoarding are kind of coming from in terms of their sensibilities, right? Because to us, what might look like things that are not of much value to the client has a lot of value. And if you think about hoarding in connection with things like history of trauma and addiction and compulsions and things like that, it's very emotional to just take something away that the person sees as very valuable. And if you think of all the loss the person's already been through being homeless, you can imagine how that would immediately get in the way of them wanting to have a relationship with you. I mean, you're automatically from the get-go kind of threatening their stuff. So it's really a very delicate issue, and I think we kind of work on a boundary with that, sort of like, first of all, we have to think about when to even work on that, because if that's the first thing we work on, there's the risk of really alienating the relationship. So much depends on the circumstance. So much of this stuff we're able to use often if it's in an apartment or in regard to a storage facility or in regard to just how many things they can carry. We try to work off of natural consequences. So it's really not us setting limits on how much stuff they can have. It's really in response to, we don't want them to either lose their housing or lose their storage facility or lose something else that's of value to them. So a lot of this work, if you think of change model, we're pointing out discrepancies between what they value and what their goals are and what the continued behavior of hoarding might interfere with some of those goals. And we're trying to go from pre-contemplation to contemplation, ultimately to an action plan. So it's using that kind of stage work. But you can only do that after you're already engaged well, after you've already developed a good common language. And that's why these 5 principles kind of all come together in the way that we think about the work.
I mentioned at the beginning that I perceive sort of a tension between relationship building being inherently, well, I think mostly a slow process, a process that includes many stages. And then there's this other side of, well, we've got, our numbers are low, we're going to get our funding cut if we're not reaching these marks, this many referrals to treatment or this many housing placements or whatever it is. Mm-hmm. And it's not just, and it's not to put that manager position, maybe saying that in a poor light, they have their own pressures. So what do you say to folks who are struggling with this tension? Is it forward them this webinar? What's the recommendation?
Well, I'm not going to say I have necessarily the answer to it, but I will say that one of the things we do, for instance, is we think about open versus admitted clients. So we're keeping track of all our clients. Some are open or some are open and admitted. And what that means is when people are admitted, there's more paperwork. It's more of a case that's tracked in a certain way. But at the same time, we're keeping track of the people that are not getting to that stage. They're in a different stage of engagement. They're not willing to do the paperwork or to answer the questions or that kind of thing. We're able to still say, well, we're also working with this other group of folks as well, and there's some numbers there as well. The other thing, I think, is to be able to bring the data people into the conversation. So when I talk about common language development, it's on so many different levels that we need to do that. I mean, when we're when we're referring a client to a service, we need to develop a common language with that service and us to talk about how to best serve the client, right? If we're working with people that are interested in data and grant writers and the people that are overseeing our programs, we need to develop a language with them that understands what the reality is on the ground and to come up with some answers along the lines of data that they value that might resonate in their world to consider how we can track some of these things, but in a different way, in a way that's productive, that doesn't get in the way of the mission of the service. Because the ultimate mission is outreach and engagement, right? And getting people the services and the resources that they need. And with some people, if you go too quickly on what the data is asking you to do, if it involves certain intakes, certain questions, certain types of surveys, it might get in the way of the engagement piece. So I will say, engagement can be very quick with some folks. It can be very long with others. The point is, when do you actually get to that point of contracting for a service where, not everyone will even put their signature on the line to agree to a service, and then you have some workarounds in regard to that. There may be ways to report data in aggregate as opposed to in reference to individuals. So there may be still ways to collect some data on some of those folks without, even though they're not getting permission on the data on the dotted line, because you're not sharing specifically who they are through the data. So I know that's not like an easy answer that we put a bow on top of, but we're all doing the best we can with the data concerns, and there are some great reasons for data. Like I said, I think in the political arena, that becomes important to be able to say, well, how many people are out there and what's going on and what's working and what's not working. And I think the data helps us to tell that story along with narratives.
Yeah, and there are
Can we draw the
answers in healthcare for the homeless experience.
Can we draw the data people into the room, and have these kind of open dialogue with them? So it's really using these kinds of approaches of engagement and dialogue at all levels.
So we just have 3 minutes total, and I don't know how much time you need for closing remarks, Jay. There's just one more question about your perspective on when other departments are sort of interfering with your work and relationship building. So maybe it's police sweeps or Department of Public Works or things that, other agencies that are in the continuum of homeless services who may be harming in some way. Can you address that succinctly?
Do that in 30 seconds. Again, it comes down to really meeting with some of these folks. And, I've seen, we do a lot of meetings with police, for instance, in the areas where I work, with police departments. And for a particular town, we'll have a meeting with some representatives. And we have some people there from the town who are also interested in the issue of homelessness and trying to help resolve it. So a lot of it is the outreach and the connections and getting enough people on your team so when we meet with the police, you could actually try to get them in as a bit of a participant. And maybe in some ways coordinated entry and housing first can speak to this, because if you're working with some folks and the police are dealing with it regularly, the person's intoxicated or they're in front of a business, they're getting complaints from the community, whatever it is, if we say the answer is housing and we actually show that we can get some people in, supported, and housed, then they're no longer on the beat, where the police person is. And I think what I found over time is we've been able to demonstrate that in these different communities that we work, and the police have become now more of a friend and less about criminalizing and less about sweeps and more interested in sharing information and helping us to connect with the people so that they don't end up in jail or the police aren't spending all their time dealing with these folks. So again, it's finding a way to have that kind of productive dialogue. Within a minute, it's very hard to answer, but it's along those lines. Yeah. So if I could end
is there anything else to conclude? Yeah, go ahead.
Okay. So I'm just going to read something quick from Cross-Cultural Dialogues. It's Cross-Cultural Dialogues on Homelessness. It was something that came out last year, co-edited with Robin Johnson, who's the father of the psychologically informed environment movement. And I think I just wanted to end on a little bit of a note of hope. I can still hear the echoes from a distant place. It was a time when people did not believe in the possibility of directly housing long-term homeless individuals without first requiring treatment. There was the din of the naysayers and the doubters who thought it could not or must not be done. Yet here we are in the midst of a movement. Over the past several years, we have unveiled the promise of finding homes for the most vulnerable among us who live on our streets and at the edges of our communities. Through the hard work of outreach, housing first, and the transatlantic truth of trauma-informed care, we have begun to make that promise a reality. And with that, I just want to say, thank you very much. It's been great doing this, and I hope people just continue the great work that you're doing, and I hope this kind of approach perhaps can be useful in the work that you do. Thank you very much.
Thank you so much, Jay. And just quickly, we ran a couple minutes over. I want to thank everybody for showing up today. And let's continue this conversation. Get involved with the council. Join as an individual member for free. And let's keep this conversation going. So thank you all for the work that you're doing. When we close, an evaluation survey will automatically appear in your browser. Please complete it so that we can improve our work going forward. Thank you so much.
Thank you.